What screening guidelines are essential for USMLE Step 3? Imagine you're the doctor making decisions for real patients. The United States Medical Licensing Examination, Step 3 tests your ability to manage preventive care. Knowing the right screening guidelines is key. These guidelines help you decide when to screen for common diseases and conditions. The exam focuses on outpatient care, so being familiar with current recommendations is a must. Let's start with colorectal cancer screening. For average-risk adults, screening begins at age 45. The most common method is a colonoscopy every 10 years. If a colonoscopy isn't possible, stool tests like the fecal immunochemical test are options. The goal is early detection, especially since the age to start was lowered from 50 to 45. Lung cancer screening is next. Adults aged 50 to 80 who have a history of at least 20 pack years of smoking should get an annual low-dose computed tomography scan. This helps catch lung cancer early in high-risk individuals. Patients who have quit smoking within the past 15 years still qualify for screening. Breast cancer screening involves mammograms. Women aged 50 to 70 should have a mammogram every 1 to 2 years. For women aged 40 to 49, screening should be based on individual risk factors and preferences. Shared decision-making is important here. Cervical cancer screening starts at age 21. Pap smears are recommended every 3 years for women aged 21 to 29. For women aged 30 to 65, co-testing with pap smear and human papillomavirus testing every 5 years is preferred. If testing is done separately, pap smears can be done every 3 years. Diabetes screening is recommended for adults aged 35 to 70 who are overweight or obese. Screening involves fasting blood glucose or hemoglobin A1 degrees Celsius tests. If the results are abnormal, further testing and management follow. HIV screening is advised for everyone aged 15 to 65. Testing outside this age range depends on risk factors like unprotected sex or intravenous drug use. Routine screening helps identify infections early. Other important screenings include blood pressure checks for all adults aged 18 and older. Lipid profile testing is recommended for adults aged 40 to 75, especially if they have risk factors for heart disease. Osteoporosis screening is advised for women aged 65 and older, or younger women with risk factors like family history or previous fractures. Understanding why these guidelines exist is just as important as memorizing them. They balance benefits and harms, consider patient preferences, and look at cost-effectiveness. The exam often tests your ability to apply these guidelines to individual patients, not just recall facts. In summary, for Step 3, you need to know the current evidence-based screening recommendations for cancer, cardiovascular risks, infectious diseases, and metabolic conditions. This knowledge helps you make smart clinical decisions in outpatient care, which is a big part of practicing medicine independently.